Well, it's been so long since we've seen our last guest, Kelly Clark. She's the Marketing and Communication Specialist with Titusville Area Hospital. We just needed to check in with her. Kelly, how are you?
Good
to see you.
I'm good. Thanks for having me back again this month.
Yes.
Yeah.
It's been a busy month for you. A lot going on.
It has been a very busy month.
And you brought in some special guests here today. Who'd you bring in?
I did. So we've had Lisa on the show with us before. This is Lisa Cox.
Hi, Lisa. How are you?
She's
Great,
a
thank you.
Pennie sister with Meadville Medical Center. And joining us also is a new Pennie sister, Jennifer Reese.
Good morning.
Jennifer, welcome.
Thank you.
Lisa, let's start with you real quick. Just give us a quick rundown of who you are and what you do.
Absolutely. Lisa Cox. I am a Pennie sister. I help enroll the community into Pennie Health Insurance, which is our state-based exchange.
Awesome. Jennifer, how about you?
Yeah, so I'm currently in training. I just recently started and I work alongside Lisa. And so I am learning all the ins and outs about, how to assist people in obtaining insurance.
That's great. Well, let's talk about it, Kelly. This is obviously very important. We're coming into a pretty busy time for you in this department.
Yes, definitely a busy time. So October starts open enrollment. So to really assist more people, Lisa takes care of the Meadville side of things and also a lot of Crawford County, which includes us. But recently they have expanded her territory to include some other counties. She could probably elaborate more on that. But so we will be having Jennifer Reese in the Titusville Health Center office.
Nice.
And it just another step to help people in a rural setting get the health care they need.
Well, Jennifer, we'll talk about what you're able to do in that location. But Lisa, real quick, kind of run down what is Pennie, and if somebody's confused by anything, what's the procedure of getting in front of you and sitting down with you?
Yeah, absolutely. To be quite honest, most of my enrollments are done over the phone. I absolutely can see you in person also. Reaching out to us, you can find us. We'll give our phone numbers. You can find us if you go to pennie.com. That's PENNIE.com. You could find us on there. So what our main goal is to help everybody get enrolled into a health insurance that's affordable for them. We go by your household size, income, zip code, all of that factors into to see if you qualify for a tax credit. Tax credits are given to help lower your monthly premium. And then this year, I'm sure that most people are aware that they're talking about some big changes, which Congress has till the end of this month, which we're praying that will change what their plans are with after you would get over the 400% poverty level. An example would be a household of two over 82,000, I believe 600. At this time still qualifies for a tax credit to help lower their monthly premium. What they want to do is stop everybody that's at that cliff of 400% poverty level and no longer allow them to have a tax credit. So we're really hoping that will change. And then we'll have a 19% increase for people that are underneath that 400%. So, I mean, you're still going to get tax credits. It's still better than what would be going out looking to buy individual insurance, but it's that 400% poverty level that we're concerned about.
Who should be contacting you or sitting down with you to have these conversations? And I guess what I'm asking too is, I mean, if insurance is being offered through somebody's work, but they're listening to you and going, boy, that sounds like maybe something I should explore. Are they able to do that or no because they're being offered insurance?
Absolutely. If you are offered insurance through your job, then you usually do have to stay with that insurance, unless it's possibly considered that it's too expensive. There is a ratio that we can figure out to see if it is considered affordable, not affordable. A lot of people, this is what works great for people who want to retire early. I mean, this comes in really nice for them. Newly married, just had a baby, your job does not offer insurance. It's a lot of people out there. You're turning 26 and no longer going to be on your parents' insurance. definitely you would qualify. And then with open enrollment coming up, which I'll let you tell a little bit about the open enrollment time periods, that's when we want everybody for sure either to enroll or to be sure you re-enroll, so we're sure we get you into the plan that's best for you for 2026.
I may, and in fact, while you were talking, I'm going to retire during this interview because I've already enrolled. I just went through the website, so I may just head out. But thank you.
Quick.
It's that quick.
That's wonderful.
And then, real quick before we get to Jennifer, if somebody sat down with you last year, should they contact you again to see if anything changed? Because a lot does change, right?
Absolutely, especially coming up this year. So I'm already making appointments for open enrollment. We definitely want to get in there. Plus, lots of times, if you're on Social Security, you get that COLA raise, so you're going to have a little bit of different income for next year. And if you just retired, next year your income is probably going to be changed because you don't have the job, or just you get raises, or you have a different job. So it's really, really important, especially this year, to reach out to re-enroll during open enrollment.
Okay. Jennifer, explain that open enrollment. I think sometimes that confuses people, or maybe they're trying to get on at a different time of the year and they're having trouble. So talk about open enrollment.
Yeah, sure. So open enrollment is from November 1st through January 15th, right?
That's correct.
Correct, thank you. And anybody during that time can enroll. Otherwise, if it's outside of that time period, you have to have what's called a qualifying life event, which could include, marriage, divorce, the birth of a child, etc. And so at those times of the year, outside of open enrollment, if something like that happens, you can also enroll during that time.
What's the process like? If somebody were to contact you and schedule an appointment, and I think Lisa said you could also talk to somebody over the phone, but how much time should somebody set aside to have a conversation with you, whether it's over the phone or in person?
Yeah, I would say for a brand new enrollment, if someone could set aside about an hour, that really takes the time for us to explore all of the details that are needed to make sure that we are choosing the correct plan.
What kind of information should somebody bring with them or have with them while they're having that conversation? Or is it a lot of, maybe there's an initial conversation and this is the stuff you need to provide or find for me to help guide you? Are there things like that, or what?
Yeah, information that someone should bring to their appointment includes any kind of income, household size, any plans for any kind of medical procedures that they know might be coming up over the next year. If they require certain doctors, so if they've seen previous doctors before and they want to continue seeing those doctors, having those names available is also helpful, along with any medications that they might want to or have to be on. That type of information can really help us look at the plans that are available and, again, really guide someone to choose a plan that's right for them and their families.
How much changes year to year? Is it subtle changes, or are they sometimes? And I know, Lisa, you mentioned maybe what's going on with politicians right now, but those other little things that come up, it is something that people should kind of be paying attention to, right?
Definitely.
Okay.
Lisa, maybe you can expand on the types of changes that happen year to year.
Yeah, every year, there may be plans changes, of course, that you had from this year to next year. Maybe there's a different plan offered or not offered. So it's very important.
Or you personally might have gone through something in the past year, right? That says, okay,
yes,
now I need maybe this kind of care.
Right. Or,
Exactly.
yeah, that, or maybe income changes that you will either be able to pay a little more, or maybe you want a different plan that's not as costly.
Kelly, for you, I assume the hospital also has patients who are asking you questions, and you're guiding them to their department. What sort of things do you get? What are you hearing, and what's sort of the response once somebody is talking and learning more about Pennie?
So we have a lot of things set up for folks that are maybe uninsured, We have financial waivers. But if they don't qualify for a financial waiver, pushing them into an insurance policy is probably going to be the next best move for them so they can be covered throughout the whole year, especially if they have kids involved and, like they said, life changes. So maybe that they weren't aware that maybe then they do qualify for this and it's not going to cost them that much. These plans change every year, so we really just want to have that information ready for someone. Not everyone plans on coming into the emergency room and having something drastic happen. So having this insurance in place prior to that is a really great idea, to have an appointment and get set up with your insurance ahead of time. But if that doesn't happen, after the fact, you can always come in and see these folks and help direct you in the right path.
Lisa, there's a website people can go to, Pennie.com, and they can start to get some information. But do you find that it is best for them to call and ask questions? What kind of questions do you get from somebody who might start looking and then they're saying, there's just so much here, I'm so confused?
Right. We want to, of course, everybody cost is the first. And then we're just checking to see when we're doing that. Like Kelly said, we're checking, will my medication be covered? Will I be able to have this surgery? How much is it going to cost for lab work? All things like that. One other thing I did want to mention too, that the applications also will decide when we fill them out. Maybe the children will go to CHIP, or they'll send them to Medicaid too. And by the way, CHIP, the kids can be enrolled into that all times through the year.
So not just during this open enrollment period.
Yeah,
Okay.
exactly. And Medicaid throughout the year also, if you qualify.
Jennifer, I would imagine those are things that maybe a lot of people don't know, and by having a conversation or sitting down with you, they're going to at least have everything in front of them that they can make a decision. And there's a little bit of time right now to have that conversation, right? As opposed to waiting till mid-January where that window closes and you're like,
Yes.
wait till next year.
Yes, the earlier the better. And then, they can see what all their options are, really have a moment to then look at those options and examine which one is best for themselves and their families.
What are, I would imagine some other questions you might get are, am I able to keep the doctors that I have? Because I think sometimes if you have, insurance through work, it seems like every year things get changed and you're always like, okay, can we go to this doctor? Can we still go to, I'm sure you get questions like that as well.
We do, especially for people who are managing an ongoing chronic illness. It's really important. They've already established relationships with their physicians, and they usually like to keep them. And so we're able to look at the plans that are available and see which physicians and facilities are included in those plans and guide the person in the right direction.
Being located at that new office location, that opens the door for what areas for people to call or stop in?
Yeah, so I'll be focused really in Warren County and clear over to Potter County.
Oh, wow.
Yeah, so a little bit of a range there, but I will be out of the TDU'd office. And so, as Lisa said, we can also do a lot over the phone. So even though, it's a wide, geography there. So certainly for people who it's not as convenient to meet in person, we could meet over the phone. Also, Zoom and Microsoft Teams, we can do the video chat as well.
Nice. And then Lisa, for you, what's sort of your territory?
So actually I'm over all of that, but we've got Jennifer I'm just telling you, she's taken off running. So mainly for me, it seems that I am Erie and Crawford, Mercer, Venango. I even sometimes have people call from Pittsburgh, and I had a few people from Forest, but that's where we're super excited to have Jennifer. She is coming in. She's from that area, and she's going to make big changes up there. We're really excited to have her there to get that communities in that area enrolled.
That's great. Let's do this real quick. You're watching The Morning Drill on Stream TV and on the Armstrong Neighborhood Channel. Friends from Titusville Area Hospital and Meadville Medical Center here this morning. And Kelly, before we kind of recap everything with Pennie, anything else going on with the hospital you want to mention?
Yes. So I know recently this month, I'm just keep coming on the show every other week here.
Yeah, you actually have an office up here now. So that's...
That would be great. So we had Devin Zarovchak on. She's our new audiologist at the hospital. She will be starting very soon. We were getting some equipment ready for her. She's offering a lot of different services for anyone that's having any hearing complications. She's offering diagnostics for current hearing aids. If you have current hearing aids, hearing aid cleaning. If you're having issues, she can do cleaning for you, and really just troubleshooting with you if you're having any hearing loss at all. So I just wanted to touch on her a little bit more because after we spoke with you, we went to the YMCA that week and did a talk, and the overwhelming need for her is very apparent.
Oh, wow.
There was a lot of questions, and a lot of people really excited about bringing that service here. So I just wanted to touch base on that again and let everyone know that you can call the hospital.
Did my wife call because she claims I don't hear her?
Yeah.
Okay.
So you're different. I don't know if we can help you.
Yeah, well, that's very true.
So to get in touch with Devin, you can call her office line. She's doing services out of the physician services at the hospital. So that number is 827-9770. We also have Dr. Timothy Scott. He'll be doing podiatry. He will be coming on board pretty soon. He will be visiting Titusville on a part-time basis. We don't currently have a podiatrist there, so that will be really great. He's also going to offer some wound care for more complex wounds. We currently do have a wound clinic that's run by our physical therapy inpatient department right now, but he's going to be able to offer some more help for more complex wounds, which is also a need in the area. We haven't talked a lot about it, but I know there's a lot of excitement. Lindsay Thompson, she is a nurse practitioner. She is going to be doing dermatology, and that will be starting in January. And also, like I said, definitely a need in the community. So we'll be excited to bring her on. So those are all people that I'll probably be bringing on and talking about some more.
I know it's January, but you're like blink and it's going to be here.
Yeah, it's going to be here.
And then Donate Life.
Yes, so we just got our designation for platinum recognition for our work during April for Donate Life. It was really exciting. We had a lot of fun activities during our Spirit Week. We actually had a family come in and talk about how Donate Life had affected their family. It was just a really fun week, so that designation just came out. So thanks for bringing that up.
Well, yeah, congrats. That's a lot of work goes into that. So
yeah, it does.
Lisa, you hear Kelly. Obviously, we've talked before. There's so much going on with our local hospitals. It's outstanding. You have to smile when you come into work, knowing you're helping not just people in our community, but you also are working for an organization that is making sure that the needs of the community are met, and you listen to patients, and that has to be a good feeling to have.
I don't think that I have ever done an interview without saying how much I love my job, how blessed I am to be helping the community, working for such a great organization. People might have a life-threatening illness, didn't think that they could get their needs taken care of. There's so many scenarios. We could go on for days of the different people that I've helped. Yes, I love what I do, and it's a wonderful community that we live in, and we have wonderful resources, so definitely blessed.
Well, and Jennifer, for you to kind of pinpoint an area that is really rural, right, and outside, quite a ways away from the nearest hospital, it's probably nice to know that they're thinking about that area and saying, okay, how can we help serve these folks in these communities?
Yes, absolutely. And of course, in addition to helping people with their insurance needs, we can also connect them to other resources in the community. So that's a really rewarding part of the job, and I'm really looking forward to getting out there and meeting more people and being able to do my part in the community.
Now, has Lisa warned you that you might be at the grocery store and somebody behind you says, hey, tell me a little bit more about Pennie?
I told her that.
Did you? Okay.
I am sure that will happen. Yes, I'm prepared.
Not to bother you here, but...
and I did get them enrolled, so it did work.
That's right. That's right. And that's okay to have those conversations.
Yeah, for sure.
And you have to smile at those moments, too, just
Absolutely.
knowing that you're making a difference. And again, so Jennifer, back to you. just recap that enrollment period, and what's the best way to get in touch with you in your area? And again, over the phone or in person, do you find that a lot of people find it more convenient to sit down in front of you and look at everything, or they don't mind talking to you over the phone?
I would say that most of the enrollments are done over the phone currently. So if anybody would like to reach me, I am available at 814-484-1022. And I am located in the Titusville medical office. I believe the address is 115 Main Street. And so if anybody is interested, they can give me a call, and then we could schedule the appointment either in person or over the phone.
Great. Lisa, for you, how do they get a hold of you?
814-333-1758. And my office is located at Meadville Community Health Center, 640 Alden Street. But I, the same as Jennifer, to call me first to make an appointment.
Yeah, you don't want just everybody breaking the door down to...
Yeah, it's horrible. We have security out there.
I think it's that little candy dish, right?
It is, but I just wanted to say security. It sounds better.
People want those autographs,
They do.
And then, Kelly, if folks want to find out what's going on, the latest news with the hospital, how do they get that?
So you can follow our Facebook page. We like to post everything that's going on Facebook. We also have a website, titusvillehospital.org, and you can always call my office. I have a wealth of information I always like to hand out to people, so to get a hold of me directly, 827-1060.
And job posting, career opportunities are always posted. So
yes, we have been filling a lot of our positions recently, but we still have a couple more. So if you are looking to look and check and see what we have available, we have that on our website under our careers tab, and we also have that on our Facebook page. If you don't have internet access, that's perfectly fine. You can give our HR office a call at the hospital.
Great. And that Pennie enrollment period is between when?
November 1st through January 15th. We prefer, I always tell everybody, if you get enrolled between November 1st and December 15th, your new plan will take effect on January 1st. From December 16th to January 15th, your new plan will take effect on February 1st.
Okay. Lisa, Jennifer, Kelly, good to see you. Thanks for your time.
Thanks for having us.
Great information as always.
Thank you.